This time we take a 35-year-old lady, and she's she's become increasingly ecteric, not hysteric, huh? Ecteric. And it's not forever, it's for the past month. So here what has a history. She has bouts of colicky. Oops, I'm writing that. I was about to write it in French. Colicky, C-K-Y there, of colicky pain, and it's in the right upper quadrant. Those colicky pain. I'm gonna tell you, although we are unlikely to do this, but in pathology we always imagine we're going to take a biopsy of everything, and I'm going to tell you that the liver biopsy in this patient shows bile duct proliferation. It also shows intracanalicular bile stasis. So obviously that would explain why that person is ecteric right now. I'm also going to tell you that there is no necrosis and no inflammation. So which lab test, which would be measured in the serum, in the blood of the patient, which lab test findings is most likely in this patient? So forget about drugs one moment there. Let's work with lab test. How about that? And let me hide one moment. Whoop. There we go. So I give you 5 different lab tests, and just based on this short presentation, you're gonna decide for us, is it going to be increased AMA, anti-mitochondrial antibodies, HCV antibodies, increased indirect bilirubin, ammonia, or alkaline phosphatase? Let's see. I'll tell me, you're typing. You just have to click A. If you click A, you'll be counted in the votes in the box above. So that right now I have 14 of us in the poll. There could be 30 plus of us in there. Give me a few more. But we're doing good. Let me tell you, I like what I'm seeing. So what do you think this lady has? based on the presentation. Shall I show you what we already have as answers? Look, if I show you, you see that for most of the class right now, 16 of us, actually right now we have answer E, there's a few A's, and there's one C. And there's no F. I wonder why. Well, because there wasn't a choice, so that was pretty straightforward. Look, let's go in order. Some of us wanted anti-mitochondrial antibodies. So those of us who answered anti-mitochondrial antibody, that would be pretty specific of which liver pathology. Well, there would be some cholestasis. Let's see, Sharon. Allah, you would know too, because you had chosen this. Yeah, that would be classic of primary biliary cirrhosis. And the main reason I'm going to have to tell you, no, it cannot be A, is because of this. There's no inflammation. As a matter of fact, in primary biliary cirrhosis, what type of inflammatory response you see that gives some florid destruction of the intrahepatic bile ducts? Let me help you. It would be a type 4 hypersensitivity reaction, a delayed T-type, DTH. You see granulomas. There would have been granulomatous destruction. So granulomatous destruction of intrahepatic bile duct, I would have seen inflammation. Can be A. By the same token, it can be B, because there is no inflammation. Where is the inflammatory response to a hepatitis, a viral hepatitis? Let's see, Sam. Well, yeah, in the liver. But what I mean is with respect to the hepatic lobule, Sam, which zone is where you're more likely to see the inflammation? Exactly there, in zone 1. And so there would be what we call periportal. Around the portal triad, there would be periportal lymphocytic type of inflammation. There would not be granulomas, obviously, but there would be an influx of lymphocytes, monocytes in the periportal area. So that doesn't work. I realized that this person has bowel stasis, and bowel stasis therefore has cholestasis. Classically, it means not indirect, but direct bilirubin. And what is the most likely reason for that bowel stasis? There's no inflammation. It's a lady in her 30s, mid-30s. Maybe she's a little bit overweight. Who knows? Maybe she has high cholesterol, high triglyceride. And she's developed some biliary colics. So you're thinking of classic gallstones, cholesterol stones, fat type of stones. Absolutely, Sharon. And it would not be increased ammonia. Increased ammonia, that's what you would see in cirrhosis. And then there would have been encephalopathy. And here there's no symptoms showing encephalopathy. There would have been seizures. There would have been brain edema. Here, only jaundice. So that's why you couldn't choose D. So you left with E. Increased alkaline phosphatase, which is going to be a marker of the bile duct injury. So that was our first question. Of course, the descriptive is going to put you on track of what is causing jaundice. Jaundice, the first thing you're going to have to work out is it conjugated or is it unconjugated bilirubinemia? But let me make another question and then we'll take it from there maybe. I'm going to tell you that I have a patient with